It's an emergency endangering our most vulnerable, and it fits in the palm of their hand. Surgeon General Vivek Murthy says the harms posed by social media to teens warrant a warning label stating what it can do to their mental health. It's a move that requires action from Congress.
There's growing evidence of harm. It shows us, in fact, that when adolescents spend more than 3 hours a day on social media, we're seeing an association with a doubling of risk of anxiety and depression symptoms.
A real and present danger, considering the average teen spends almost 5 hours on social media each day, according to Gallup. Parents have been pressing lawmakers to address this for years. It's not uncommon to see them on Capitol Hill lobbying for change. Back in February, we caught up with Naveen Radwan between her meetings with lawmakers. The California mom of 3 almost lost her teenage daughter to an eating disorder.
I know for a fact that the trigger for her was social media.
As for the social media companies, they generally favor regulation at the App Store level and also provide tools and tips for parents to monitor their child's use.
What do you make of the argument that this is on parents at the end of the day?
It's not. I put every single restriction available on those phones for my kids. I made sure they didn't get phones until after they were 13.
Many children are on social media well before they turn 13. New Wall Street Journal reporting highlights just how exposed young girls are to grown men. They detail an account of an unnamed mom in the Midwest who supervised her influencer daughter's Instagram account, which at one point had more than 100,000 followers, about 92% of whom were male. Meta shut down the account in a matter of months. Lawmakers, parents, the social media companies themselves agree more needs to be done to make these platforms safer. There's just no consensus on how. A simple warning label could be a start. The moral test of any society is how well it protects its children, the Surgeon General writes. We have the expertise, resources, and tools to make social media safe for our kids. Now is the time to summon the will to act. Our children's well-being is at stake. In Washington, I'm Atrell Nishar reporting.